quality over the years, the ways in which we can continue to reduce people's exposures, gets more and more challenging, kind of the diminishing returns type thing. But on maybe not untapped area, but an area of interest and focus of mine was, what can we do around making our cities smarter, planning them better, and tackling air pollution exposures at that local scale through thinking about urban form and urban design. And clearly, as we're talking about that, there are many things that could be benefit from thoughtful urban design, not just air quality. So it's a sort of a broader public health opportunity in thinking about urban design. The talk I'm going to talk about today is about something that we have built from the original endeavor about CANU, Canadian Urban Environmental Health Research Consortium, that I'll introduce at the first part of my talk. But in terms of the major questions that we think about for healthy cities, these are some broad ones that I use to sort of guide where we're going, which is how do we track urban environmental health risk factors in terms of measures, indices, and data, and from that, with those data, can we learn more about what features are posing the greatest risk to the population, and where might we gain the most benefit in intervention? So that's a much broader environmental health research question. But with that knowledge, we can start to do what I said. We can start to steer investments in urban infrastructure towards better health for Canadians, or at least start to ask that question with the data and the knowledge. Those changes could be motivated by much higher level driving forces that we know affect cities. And certainly cities are at the forefront of having to deal with climate change or also reducing greenhouse gas emissions and their carbon footprints. So are there ways that as those happen more and more, that public health benefits can be maximized? Many of us might have heard of the co-benefits of reducing air pollution or reducing greenhouse gases and having air pollutants be reduced at the same time, and realizing co-benefits like that. Others that are pretty clear would be switching to active transportation, which reduces our individual carbon footprints and also at the same time is good for your health. So there are many ways we can think about optimizing public health as we go about decarbonization. And we really want to be able to facilitate urban planning, policy decision-making with available data and bring it into the conversation more actively. But data is sort of a key part of that. And one of the things that we started in my research work at University of Toronto was the Canadian Urban Environmental Health Research Consortium, which was an effort to bring environmental exposure data together to support a wide range of epidemiological and other health research as the prime motive. And there are many reports that talk about the importance of having standardized open data and the role that it plays. And of course, we know the big priorities for open data, open science within all governments as well. So we felt that launching down this path had many motivations from the public health standpoint, but also from the open data standpoint as well. And it's now, we're into like beyond year 5 of CANU, hard to believe. And I think it's taken us quite a ways to where we are now that I'll talk about healthydesign.city. So the conceptually, the thought with CANU was that there is quite a bit of data on environmental factors across Canada, and if there are researchers who are health researchers and want to apply it for a question around how environment affects health, they generally seem to go to the same individuals who are working in different areas and reinventing the wheel each time. So that it was sort of a one-off type way the research was done, which meant it was kind of difficult to compare results, difficult to reproduce or reuse, because it was always sort of new partnerships forming in the health or in the environmental exposure side. So the proposal with CANU was to see whether or not we could bring one group together, a consortium, CANU, Health Research Consortium, to serve as the platform for bringing in data existing data and newer novel data around environmental health, index it to postal codes, which is what's used for most health research studies, and then make it available more widely to all health researchers. So it became more standardized, more easy to reproduce. Many more researchers get access to it. So a much more efficient model for advancing research in this area. So conceptually, really, we are working on environmental health data, which are largely, geospatial maps of various parameters across urbanized parts of Canada. And they are something that's critical in terms of epidemiological studies on environment health, and thinking about the relative impacts of different risk factors, thinking about who's vulnerable in the population, and how we might over time track this and also lead to improved public health. The key questions are there that are some of the things that we think about in using these data and mobilizing these data beyond health. And in terms of being able to provide health research, Canoe has developed the tools that we need to make this analysis ready data available, such as an example here of our portal for downloading the data. But here's just a quick sort of summary of who we are and so where we've come in the Canoe effort. So we have amassed a large amount of data. Always could be more, always could be better, but we do have a portal with an extensive amount of data that's indexed to postal codes, which means it's easily linkable to health research studies. And we partnered directly with a large number of major health research cohorts in Canada. I've worked personally a lot with the largest birth cohort, where the children, when we started, weren't born yet, and now they're around 13 years of age, known as CHILD, spread across 4 centers in Canada. There's also a very large aging cohort in Canada called the Canadian Longitudinal Study of Aging. And then the largest cohort, and I share offices with them at U of T, is known as CanPath, which is a combination of prospective cohorts in multiple provinces across the country, the biggest being the Ontario Health Study that maybe even some of us are part of or heard of. And then there are other administrative data sets that we also link to directly. So by putting environmental data right into these valuable health research platforms, we've been able to really accelerate environments and health research for those who aren't naturally working in that area. And that was sort of the operating hypothesis I had, was that there is much more interest from the health side to do environmental research, and there's much more health data that's not being tapped into for that sort of research. And if we could make the data more readily available and build it, they will come. And it really has happened, I think, in spades. So we're in with these large cohorts, but I would say we're now, working with many of these health research platforms in Canada, from a large COPD cohort to now recently a neonatal cohort in Canada, and several others as well. So I think we built it and they did come. That over our time as a platform bringing data available has sort of grown in terms of the number of people that are part of Canoe, and a number of publications that we've enabled. Some of them we've done ourselves, others we've enabled others to do during this time. So there's been well over 300 data requests, and I think we're getting requests on a weekly basis from anywhere from students to independent researchers. More than 125 scientific publications have used Canoe data or other support, one shape or form, since we started, and at least 20 different graduate student theses have come from what we've enabled in Canoe. But it's a data platform that was being widely used for health research, but there's so much more that you can do with that data. And certainly we knew that in terms of our big goals were that we would help enable the health research, but the research evidence was to advance better decision making around urban planning. But we recognize that the data itself has value, and urban planners and other public health professionals, if we could make the data accessible in a good form, could use it directly. And so we with that idea, and with clearly this point that I've already sort of expressed, that communities need to be planned in a way that maximizes all aspects of population well-being. But part of that is the need to also consider inequitable distributions of exposures and other inequities, and how in doing this we can deal with public health and inequities that exist in our communities, as nicely stated here by the BC CDC. And so in thinking about canoe data and thinking about that point, and knowing the landscape right now, which it's a very hot topic, this area of environmental justice, if you want to refer to that in that form, in terms of the United States, papers coming out all the time on exposure distributions across different community groups, or even in Canada with Bill C-226 last year, talking about environmental racism and the Environmental Justice Act. And so that sort of gave us further impetus to think about not just our data as our data, but how it intersects with demographic information and how that might actually support decisions more directly than just the data. And we, in thinking about that and thinking about how we might consider whether cities are fully sustainable, a central idea that I had was that cities that have significant amounts of inequity, whether it be environmental exposure or others, but let's talk about environmental exposures, inherently can't be sustainable. That if there is this inequity that's there, if the sort of lowest rung in the ladder of the population are really being unfairly exposed, then there is certainly something deeply unsustainable about that in the city. So we thought, let's look at the canoe data with demographic information and just see what was sort of possible. So Danny Doiron, who was the managing director of Canoe, led this analysis in the three major cities. And we looked at three variables. One was walkability in the cities, one was air pollution, the other one was greenness and access to greenness. And we found that in areas of high deprivation and index of socioeconomic conditions, we found that there was areas where there largely 50% lower prevalence of highly walkable areas in those parts of cities, between 38 and 23% more likely to have high air pollution in those parts of the cities, and between 23 and 44% more likely to experience low greenness. And we're able to map those independently and together in these sorts of maps. And you can see from this, which is basically a data desk exercise, some parts of cities where perhaps people on the ground know they exist, but here we've identified them in more of a standardized fashion and zoomed in on sort of the intersection of these three as possible areas for focus as we look at ways to improve urban planning. And that's certainly not a surprise, the inequitable distribution of exposures. It was talked about during COVID-19 and access to parks. You could talk about it in terms of access for transportation and whether or not mass transit is serving everybody the way we think it would best serve populations, or air pollution. So it's not an unknown feature of our urban environment. In terms of heat, we all know certainly about the heat dome of 2021 in Western Canada. And the post-analysis of that has certainly indicated that people in lower socioeconomic status were more impacted, more likely to have heat-related deaths in that area. And that's something that's been seen in heat waves wherever you tend to look. There are segments of the population who bear the greater brunt of the effects. Some information published from INSPQ in Quebec about heat islands in Montreal, and another statement there about access to transit in Toronto. So let's look at where we are with Canoe and where we need to go and where we can have the most impact. And it was certainly a great benefit to us in planning and thinking about Canoes strategically to have Gordon McBain as part of our advisory committee in thinking about where we're going to go. And a key decision that we made was that the time was right to start to make data widely available about your neighborhood. So that's something that has not been always in favor, because there's concerns that as you start to center out areas, you might stigmatize them because of their conditions. But I think that sort of floodgates opened, and there's a recognition that no, it's important to get this information out and to use it and to recognize opportunities and look at it more in that sense, not as stigmatization, but as opportunities. So we decided to start to build tools to make the data readily available in Canoe, and receive some funding from the Public Health Agency of Canada to go from our early prototypes to something that I'm going to start to show now. And so sort of the main things we wanted to be able to do with what we call Healthy Design.City or HDC were to be able to map and visualize relevant environmental factors for improving the monitoring over space and time, identify areas of inequity, support equity-focused decision-making, think about ways to enable policy and urban design interventions to happen, with improved evidence, and with these data being available to anyone, even empowering community groups to be able to take the situation in their own hands and look at opportunities and make arguments to their local councilors or whatever decision-making body they want to be able to come to. So we've really been aiming to democratize data towards these sorts of goals. An example here of something that we did quickly with the data and got published last year in the Narwhal was a look at Toronto's air pollution. So this is in high red areas of higher nitrogen dioxide air pollution across Toronto based on a statistical model. And that's great. It kind of lines up with some of the heavier trafficked areas and more densely populated parts of the community, or rail yards there in central North Toronto. But let's overlay on it, where are we into the lower socioeconomic brackets within the city? And you can see that, of course, there is some lining up, as we've shown earlier, but with just sort of the simple overlay of two things, we can begin to think about where you might want to draw your attention first. And when we look at this and think about air pollution and decarbonation strategies in terms of, say, questions like, how do we start to transition goods movement over to being carbon neutral in the future? And if it can't happen immediately, maybe there are corridors where there is considerable amounts of goods movement, diesel traffic happening, where they're particularly situated that certain populations are unjustly exposed more. And perhaps in sort of thinking about how we start to transition cities and our transportation systems, those pieces of information can help target the earlier changes that we might take in terms of how we move goods around, for example. In thinking about how to use these data, we felt that there would be demand for just the environmental data from the general public. And so we kind of called that the Healthy Place tool. So it doesn't have the demographic, socioeconomic factors overlaid with it. And then we speculated that there would be another more professional audience of planners and public health officials who would want to see the other dimension, the equity dimension. And so then we created Healthy Plan, where those were brought together into one. I'm going to talk about what we've made available so far, which is really just around tree canopy and heat. And that's been publicly available since July. But the planning for this has been to cover a number of dimensions of urban experience, from urban climate to access to a range of different community amenities, to parks and recreation, to air and noise pollution as the main dimensions we wanted to cover first in the data platform, as well as thinking about vulnerable populations, as you can see there, whether it be age or minority or income, or combinations of the two. Low income seniors, for example, are things that we're building into this tool. But also at the same time, be thinking about this in the context of our main advantage, which is that we have nationally consistent data. It arguably is not the best data in given locations where much more work is done by researchers or by local governments, but it's nationally consistent, which provides a certain advantage to it. So as I mentioned, we were off and running with the prototypes of our healthy design tools, and had been beta testing sort of look and feel and things of that nature, and then began to be contacted by Jayla Bernstein and others at CBC Radio Canada as they were preparing stories for last July to be sort of ready with 1 year post the heat dome, and talking about heat risks in Canada with a series of articles. There you can see sort of the headlines for the articles that came out in early July this past year. And they were looking for something exactly like what we are already doing. So we were able to partner with them in the stories and have them highlight our sort of stripped down version of the tool, early stripped down version, which is just in that image there in the bottom left, which is around heat and tree canopy in different cities in Canada. And I'll do a demo about this shortly. In terms of trying to get the news out, you can read about it more in this magazine for Canadian urban planners. We were one of the articles in their environment focused issue back in the fall. And you can see some images there that are from the article in the Plan Canada story. And before I get into examples, I talk a little bit about sort of what we're doing. We're again bringing the environmental data together, and in this case, it's some that's in Canoe and others we derived specifically for this, based on what Public Health Agency of Canada was requiring, and then we're able to use GIS tools to map it to census areas, census dissemination areas, and some things at the smallest units possible for that. Access the census data for those same areas there. In this case, when we were building it, it was the 2016 census, and then come up with a relatively simple way to highlight the areas where there's perhaps we call it an equity priority area, by looking at deciles across the environmental condition and across the population vulnerability. And then you can see sort of the brighter browny orange would be an area where it's in the high decile of exposure and high decile of deprivation or inequity. And then shade maps using this sort of decile approach. One of the things we have struggled with a lot, and others do as well, is shouldn't we just simplify this and make an index that combines all these things together: temperature, heat, air pollution, parks and greenness, all into one, urban environmental air quality, or not air quality index. But we have shied away from that because it's just difficult. You don't know really what's the right way to weight things in such an index. So we've tended to keep things separate in the types of domains that I mentioned. So I'd just like to give a quick example of what's live on the web. So I think this will take me there, I hope. Can you see this, Amir?
Yeah.
Yeah. So I saw Dave Sills and Jamie Voot were there. So I thought, okay, well, let's just sort of look at what London has. The tool, as it looked in July, you can select many different cities across Canada, as you can see. You can think about whether you want to plot tree canopy or heat islands, because again, we brought this out just for something that CBC could use for their articles in the summer. Different demographic groups, older adults, for example. And so here's an example where we can quickly drill down, admittedly sitting at our desks. We're not there in the communities, but that's sort of the next step for this work, to identify areas where there's a higher proportion of seniors, and based on Landsat heat surface temperature information, where do they intersect, and where might there be some greater risks during heat waves. And in London, a few pockets happen to show up here from this sort of example. And as I said, you can pick multiple cities around the country. Where do I have you try Ottawa, for example, and you look at the same sort of thing. So this is really allowing us to, I think, quickly with standardized data at down to quite small scales if needed, to the small scale that information is available, to sort of triage a region and then begin to work with local communities or local governments to get with boots on the ground and to look more closely at the opportunities that might arise from being able to more efficiently focus your attention. We've been developing this over the course of 2.5 years or so now, and the the first phase was, sorry, I gotta get back to my presentation mode. The first phase was to sort of develop the platform and the look and feel, and then I think you probably, are you still seeing the web? And to beta test the look and feel of the tool and make some improvements. And so what you see here is not what's going to be released in the next month or so with more domains. It's going to change in terms of the types of statistics that we're showing on the right and other choices that we have there on the left. And then, as I said, more dimensions will be available soon enough. As I've talked about, this is an approach that uses simple, nationally consistent data. It's been built in a way that as data improve, we can switch data in and out or increase the amount of data that's in there. It's been built also to work at the local level. If there are unique data sets for local levels, we can import that in and work with communities that way. And this is all something that's freely available. And there are limitations certainly in terms of what information you can get that has the type of coverage we're looking for in terms of geographic coverage across the country and spatial resolution and so on and so forth. So there are real hard limits for what's possible there, but I think we're on top of things as best as one can be. But as I said, there's opportunities always to improve it. Getting to sort of the local level analyses will always get people saying, hey, I just looked at your maps and what you got for that area is wrong. And so that's part of the constantly evolving, improving nature of this and other limitations that exist. But I think the main point is that this is a sort of a first level assessment that can be done, and then there needs to be more local knowledge brought in to take it to the next level. And that's where we're at now. We have built the platforms, we've beta tested it, we've gone through a couple of iterations. We, of course, did the heat and tree canopy work during the summer. And now we're at the phase where we have a version that we want to get out for more widespread use and experimentation and evaluation in terms of how are people using it and what impact is it happening. And we've certainly, I think, in our early phases found that there seems to be quite a bit of promise. It seems to be hitting the mark for what many groups are looking for, which is reassuring. There are examples, as I said, where some will say, I just looked at your maps and it's totally wrong. And here's one where in Hamilton we had called this area, Gage Park in Hamilton, a low greenness area, and the person said, well, your point is right in Gage Park. That's not right. So we're constantly looking to work with users and experts to make sure we identify problems and issues and improve them. Indeed, somehow we had labeled the park as a low tree canopy, which the person pointed out, and that allowed us to identify what was happening in the algorithms and make some improvements. And that is sort of all part of the process of, I think, making a stronger and stronger tool. As I mentioned, there are a number of domains in there now. If we're thinking about those related to climate, Many of them are in certain ways in terms of if people were able to use this and think about areas that they might want to live where they can be less dependent on transportation and are living more in the concept of the 15-minute city design. Those all have ways to help people reduce their carbon footprints and maybe live in healthier communities at the same time. But we are wanting to be able to bring in more information that is related to the climate risks that we're facing. And one area where we're working presently right now with a number of partners there with some funding from Health Canada is around bringing in more data on wildfire smoke into the tool or a separate version of the tool, since this is much more geared towards rural, remote areas and indigenous populations. We're not sure that the exact urban tool is exactly what we want. But in terms of a climate-related environmental factor that's of high importance in Canada, heat clearly is one, which we're working on. And wildfire is another really key one for us in Canada that we're also being able to bring in and are already distributing that type of data within Canoe. Flooding is also of considerable interest. There's a picture of the Abbotsford area after the atmospheric rivers a fall ago. And so we're working with other partners to think about how we might provide something of value in our tool around flooding risks that could help with planning. But it's a very challenging area to deal with. And clearly we know that there is an intersection with inequity and climate disasters. Again, climate disasters are something that's very acute when it happens. Of course, there's great risk of loss of life and injury and damage and cost that occurs. And then there's the lingering effects afterwards that can lead to all sorts of long-lasting health outcomes, from mental health outcomes to physical health outcomes. And in a case in point would be Hurricane Harvey and the rate of recovery in Houston after the big flooding there. So there's, I think, ways we can talk about that more directly with some of our tools. Just a few statistics on Hurricane Fiona and the impacts it had. And clearly, when you think about insured and not insured populations, I think you're immediately talking again about differences in populations and their economic means. We're really just now at the stage of looking for what's available in different data sets that can tell us about flood risk. And this is one that came from a group at Western Ontario that I think uses a large amount of information on elevation and hydrology to map out areas of flood risk. So we thought, well, how does that look on the maps, and how does it look if you start to map it with different populations in terms of their income? So in this map here, we said let's look at amounts of flood water level risk. And you can see the categories here, dark green being the greatest amount of flooding, and then how does it intersect with lower income populations? And first off, the confluence on the east end of Montreal Island is where there is more low-lying areas and large risks of there being floods. But there are indeed, as you can see, parts of where the flooding happens where there are populations that are more at risk as well. Just an example, not anything that we're distributing at this stage, but we're definitely interested in those who can offer some suggestions of data sources or ways to process our data to be able to bring this into the HDC platform. You can certainly look ahead in time, and this is one scenario, and then here is going to this shared socioeconomic pathway to 4.5 and where there's more increases in flooding. But really going into these scenarios doesn't seem to increase the size of the areas that much from what's already there in a flood risk as it stands. I think broadly there's some untold numbers of ways that we want to improve this tool in terms of data and in terms of how it's used by users, including as a tool where people can share their knowledge locally. So it'll be a two-way share of information through abilities to upload photos and other insights from communities to make it a more active platform. We're thinking about how it will be used by different groups as we evaluate it. So we're going to partner with youth groups and with our immigrant communities as two sort of starting areas for more testing of how it's used and what impact it can have. But clearly, it's really sitting right square in the center of sustainable cities and communities in terms of the large SDG goals, and also clearly around reducing inequities. And I think these are things that we clearly need to be working on more and more in Canada. Just to acknowledge that this project is led by a team of researchers. Here is sort of our key research team that's helped in the early stages and guides us along as we try to improve this project. And then we have a great committee of advisors, some internationally, and others in Canada from the public health and the urban planning community that have helped us sort of shape this early phase. And then there's certainly the team that works with me, Eleanor Setton, who's was the managing director at Base University of Victoria, is mostly retired now, and Danny Dwall, who's been with us on Canoe, is now the managing director. He's based at McGill. And then we've got Alan McKee, Natalia Calahorny, and Andre Redivio, who also are there helping us manage our data sets and build different products. So we're a little bit behind in wanting to launch the full version for the evaluation phase. Keep saying any day now, but yes, soon it will be out, and you can, if you're interested, go to the website healthydesign.city, sign up for the newsletter, and you'll find out when we are releasing the full version. And hopefully you'll look at it, you'll experiment with it, and you'll provide some feedback for us so we can continue to do better. So with that, I'll end there. There's some time for some questions if there are any questions, but really appreciate everybody's attention. I appreciate the invitation, Amir.
Okay, so if you have a question, maybe you can just post it on chat, and this way I can read it to Jeff.
I see Dave Sills and Jamie Root there, and it's in our to-do list as we now grow our staff to work more with the Pan Am data set to think better about how we can consider heat risks. We had that great drive down Toronto, that one event that is just in my memory and never really been analyzed, but many other drives too. So I think there's great input you could provide us in the heat area.
Yeah, I'd be happy to do that. In fact, and sorry, I think it's easier to talk than to type.
Yeah,
that's okay. But yeah, this was really great and provides some context, because I looked at that site, but then you can, I think, sometimes get lost in small scale details versus what's needed on a consistent national basis. But one thing that came up, and I think it could link back to the Pan Am, but I had a student last summer doing some work on the London scale and looking at something, we called it the urban climate map, which is actually there's a book of that name that was written by some people from Hong Kong and elsewhere. And it struck me, as you were talking about on the national scale, there actually could be some maybe extra spatial data processing steps you could add that then go just beyond, I won't get into details of, what does LST represent and what doesn't it represent in terms of heat. But I think if you think about some other accessible layers that are available everywhere, you may be able to get to something that's got even more generalized ability in terms of representing heat, and maybe even more broadly thinking about the climate of cities and, where are the resources of cool air, right? So one of the things in London that really sticks out is the importance of the river valley, which is kind of inverting, where it's hot, right? But in an urban climate map perspective, it brings out things that could be considered resources as well as hazards. And I think that's something that there's always room for individual cities to do things, but I think there's some possibilities of doing that at the national scale, and it would link to the tools like Environment Canada has. So they can do UTCI, for example, right, which gets you a metric generated by the urbanized model that could be available everywhere, right?
Right. Thanks, Jamie. I hope we can follow up. I really, can always say I want to reconnect. And I definitely remember our drive along Yonge Street and getting into the valleys and the temperature, just the bottom falling out of the temperature. And I mean, certainly as a meteorologist, we know that those things are there.
Yeah.
So yeah, really, that's really going to be helpful for us, I think.
Okay.
Okay,
Yeah,
maybe
I'm happy to do that. Just I'll let Gordon ask questions, but Christy Ebby's coming here on March, was it 3rd? That might be interesting. I don't know if it's online or not, but
March 3rd.
March 3rd.
Okay, good. The you asked about, I see George Isaac asked about access to high resolution temperature precip model data. We enjoy a relationship with the Dorval crowd and have been getting their air quality model information and using that for a lot of purposes, but it's just really slowed down. And we've been talking with them about their urban models and starting to pull in data from those, but it just doesn't flow fast. It's usually like, we're understaffed. We don't have time to get it to you. We're working on it, but we just don't have the resources. So the opportunities are being missed, but we're kind of aware of those things. But for now, we're really for climate data, we're using the NRCan products that they've developed, and those are really limited in what they have.
Okay, another question is concerning on the air quality as a result of the electric cars coming. Will that make a significant difference in the next 10 to 30 years?
Yeah, definitely. Not anything that we can dynamically, put in this, our data sets to show that, in so much as we can update them as the composition of the on-road fleets change. We can reflect those changes. We're soon to put out a Toronto-wide map that we developed from our Pan Am research, actually, on air pollution. That's going to go from 2005 up to the present with a monthly basis. We'll really be able to show how it's been evolving and getting cleaner during that time. But going forward in time, that's much more of a CTM exercise with emission scenarios. But we want to layer onto it the information we have on the areas at risk in terms of the populations, to think about different scenarios to accelerate that movement to electric fleets.
Okay,
that's pretty much a project we're doing with engineering.
I think Gordon has a question.
Yeah.
Well, the question and a comment, but let me comment first. It was a very interesting presentation, and I had thought of several things, but I'll just focus on one in view of the other comments. That one of the important things, we have these people who are, let's say, in more at risk than others and things, but one of the things that we need to worry about is how do we let's say find the information to get it to them so they can make responses and work together with the communities. What's let's say the next steps building on your great stuff to first of all inform them when a bad event. I mean, I guess one of the things I was going to ask about first is the difference between sort of average conditions compared to a horrific event like the Eastern Canada ice storm or the Calgary flood or the Toronto flood. Anyway, these floods that happen and are one-time events. And I see Dave Sill's pictures still smiling. So, it could be a tornado coming through. It's how can we best make sure these things work together so that we don't do it one way for one part of it as opposed to the other part?
Yeah, that's a good question. Most of all of our data sets that we've been using for health have all been, these average conditions and, we would call sort of, long-term, exposure.
Yeah.
and not acute events. And certainly we know for weather and climate, it's acute events that need a lot of attention, and where impacts happen. And while we've kind of left that aside and the work with Canoe, we're seeing more and more health researchers are wanting to have that to look at, health responses after heat waves or other weather related events. So we're starting to develop tools to use the data that are available to make it for them to do that analysis. We haven't really thought about whether or not there's something beyond the fire smoke that I mentioned we're doing to make other sort of extreme weather parameters something within our platform. It's certainly possible if we start to have more real-time information come in. Not sure if we would be the best source for that, really, though.
Mm-hmm. Well, a side question, if I have a time for another one, since I've been working with the food science community on other projects and these kind of things, is one of the big issues is if you have a big heat wave or you have a flood or something, you affect the supplies of food, and that has implications both for the people who are directly impacted by the flood, but also indirectly impacted by the fact that food isn't available or cut off or not well processed or something like that.
Contaminated. Right. And so those are the lingering effects that that come in, maybe over time actually are having a greater impact, like a population that's been, traumatized by a flood in their community. And then long term afterwards, they experience adverse health outcomes.
Oh, that's great. Thank you.
Thanks, Gordon.
One other question is concerning the changing landscape in in urban environments, such as in big cities, Toronto, Vancouver, and so on. How often do you expect to update your database and information on reporting?
Yeah, well, clearly things like census, we update with the census. Things that come from satellite imagery are updatable more often. So, I think it's really more, those are things we would definitely like to be able to do to be current, but it's a constant battle to do that with our own resources or, data resources that we rely on others. So as a consortium, we can do a little bit of science ourselves and generate new data, and our team's growing to be able to do that. But we also, often are really looking at, what data are available, and is it something people can share, and can we convince them that there's an advantage for them to share it, for our work.
A related question is that Canada has announced a significant increase in immigration, and these people might gravitate towards big cities, in the urban centers.
Yeah.
So that will make a significant changes to the landscape, particularly we know in Ontario, for example, the green belt has been in the news recently, and that is being converted into possibly more development in that area. So, it's not just the greenness of the city, it's greenness around the city also matters significantly. And if that is changing drastically, then we'll have an effect on the urban landscape. Can you comment on that?
Yeah, all I can say is it completely makes sense, and to try to position ourselves in those sorts of arguments, if you want to call it that, would be good. It would be sort of one measure of impact if we're able to have data that those who are on their sort of front lines about trying to minimize sprawl are able to use our data. Then that's something we would certainly encourage. Within cities, we've had sort of some advanced contact with groups that have been trying to protect small urban forests in Montreal, and they have come back to us and said, with the data you had in your tool, we were able to make a much more compelling argument at the local council, and we think we've been able to save trees in the city. So yeah, I think that, the jury's still out on whether, how useful this will really be. And that's, the next phase, right? It was, okay, we can build this. There is a desire for this. You could even see people wanting to use this to think about where they might want to, buy their house. But does it really, lead to change is the big question. And I guess I put on a skeptic's hat and say, people are inundated with information, and this is just another thing in the noise of their life, and maybe it will make no difference. But we're going to certainly try through sort of connecting at these more local levels as a next phase. So that's going to be, I think, in our mapping ability to go into smaller sort of regions of, say, Toronto, like just Peel or just Mississauga or just Markham. And that starts to get maybe out into the edges of the cities. And lifestyles and everything are so much different in suburbia than downtown. And so that's another challenge, like what you call walkability, in the center of the city is not the same as what it might be, in suburbia. So a lot of underlying challenges to try to improve the data. But yeah, so far I'm certainly surprised at the interest across broad communities at different scales in Canada for what we're doing. But once people start to use it and scratch the surface, is it just gonna lose its luster fast? And part of that will be us keeping up with new data.
Yeah.
And speaking to certainly key issues of the time, if we can.
Okay, are there any other questions? Okay, I guess we don't.
I have one.
Okay.
Yeah, I liked Amir's question, and I actually think it's actually quite important with all this talk about cities building all this new housing, right?
Mm-hmm.
The scale of your system is intended to be at a national scale and thinking about the overall layout of the city. And I sort of feel sometimes there's a lot of attention done at the neighborhood scale using the tool, but not at the city scale and the expansion. And I think the healthy metric is actually an important one in thinking about urban design. It's kind of a wicked problem, right? Because if you choose an individual environmental metric,
Yeah.
that it's hard to, well, you can optimize it to one, but it's probably not the best overall answer. So I think that's important. But I was going to ask about the other scale. So to what extent do you think there's a need or to observe, a particular city in order to try to, evaluate the tool, right? So you've got a tool that works at this national scale, being used, at a neighborhood scale. Cities, to some extent, lots of cities aren't very well characterized at the scales where a lot of that urban design works. So what would you want to see in order to complement Canoe at that smaller scale?
Well, I can speculate, what I think, but we're wanting to I be more of an observer and connect with groups working at that scale, and train them on what's in the tool, how you might use it, and then have them apply and use it at their scale and see where it leads them, and be there to answer questions and maybe improve it, but get it into these users. So I'm hopeful that in the next year and a bit, we're going to be training Toronto youth who are part of a U of T Transform Toronto Youth Engagement Panel around climate, and get this into their hands, and then hear from them, like how are they using it at their local scale? Is it crap, or is there something that actually is useful for them? Similarly, we're in conversations with Green Communities Canada, and they're going out, working within a number of somewhat smaller cities around the country, and we're going to aim to to, partner with them in their communities, and again, train them on how to use this information, and then kind of step back and see what they're learning from it. Maybe we'll be totally surprised they use it for something completely different than what we expected, or my skeptic hat will shine through. It'll be like, nah, it was good to look at, but really I didn't need it to do what I'm doing. And it's the buzzword of buzzwords, right? Is, oh, we create awareness for this. Well, I think we're hopefully past just wanting to create awareness. So we're thinking about other types of data to come in that might be able to evaluate change. Like, there's a lot of data sets that you have to buy that are around mobility, where populations are moving and how they're moving. We all see that all the time, of course, when we look at traffic on Google Maps. But there are good, robust data sets on people's movement that we want to bring in to, I think, add more insights into the exposures, but also track change through movements or other things you can get through, like mining the Twitterverse and things of that nature. So we very much do want to launch or leap into the big data world of social media data and digital imagery and mobility.
Okay, so if there are no other questions, and it's 1 p.m., I'd like to thank Jeff and look forward to your new portal with all the changes that which are coming.
Yeah.
So,
that's hopefully you'll all spend some time on it and give us some good honest feedback. Don't tell us it's good, tell us what's bad.
okay, thank you very much.
Okay,
Thanks everyone for joining.
thanks for the invitation, and nice to see so many familiar faces there.
Right.
Happy Valentine's Day.
Yeah, happy Valentine. Thank you.